Who dat? We dat. Coming to you today to talk about COVID-19. But before we do that, there's a great video that Greg Fern put out. We're going to put a link for you so that you can click on it and watch it. And what Greg reminded us of is that every day LCMC, and Children's is no different, you are getting up and providing life-saving care for kids of New Orleans and across the state of Louisiana. Just because COVID-19 is going on, that doesn't change the fact that we still have families to care for every single day in our normal operations. I want to start a little COVID-19 discussion, so I'm going to ask you to follow me around the hospital, and we're going to ask some of our leaders how things are going.
We've added a labor pool, and we now have team members throughout the house that are volunteering to show people where to walk safely. With all the trucks that are still happening here with construction, along with everything else we're dealing with, we're adding additional resources to make sure everybody remains safe.
So here's our command center. We're catching them right at lunchtime. So thank you to the dietary team for bringing up some lunch for these guys who are working so hard. In the command center, we're very formal with defining the roles.
We're really focused on what has to happen today, the next 24 hours, what we need to be anticipating for the following 48 hours. And we have specific leaders who are looking at how we make sure that we optimize our visitor screening and our employee screening process. How do we make sure that we have the supplies that we need for the front line to keep themselves safe with personal protective equipment.
How are things going here? How are families feeling? What are your thoughts? Talk to us, Anthony.
Well, our thoughts is I think we're handling it well, and families, we're making them feel comfortable.
People enter, you got to get your temperature taken, wash your hands.
Get your wristband.
Get your wristband.
Every day we get a different wristband.
The PPE, personal protective equipment, is a big deal. You're stressed out about that every day.
Yeah, absolutely.
Right now, you've calculated our burn rate.
They have a list of PPE. They're tracking alternate sources for things. If we can't find this gown, where can we find another one? Also looking at expanding that to our other areas too. So how much hand sanitizer does housekeeping have? What is EVS doing for their cleaning supplies?
The staff keep taking care of each other. Y'all are doing a great job. Keep asking us questions when you have them, and we'll help out as best we can.
And our primary goal is to take care of patients while making sure that we effectively protect the health and livelihood of all of our healthcare workers, both clinical and non-clinical.